because I have a lot of appointments layering by each other. This is my second program for today, and I'm speaking at another program at about 2. But I'm glad to be here. I'm excited that a student body is taking this kind of initiative. So I hope in the next 30 minutes or thereabout, I will share some thoughts with you. Let me apologize ahead that I will not be able to take questions because I will just have to be away by 12 or thereabout. So there are 3 things I'd like to talk about, and if at any time you don't hear me, please let me know either by chat box or flash me or something. There are 3 things I'd like to talk about. One, to look at Africa and the juncture the African continent is now with respect to the issue that you are focusing on, the triple challenge of communicable diseases, non-communicable diseases, and poverty. Secondly, to look at what are the strategic responses we could have to these challenges. And finally, as student body and as you have requested, what would be the role of students in addressing these challenges. So let's start with talking about the African continent and its crossroad. When you talk about triple challenges, different people in literature might look at it differently. Some will talk about communicable diseases, non-communicable diseases and injuries. Some will talk about communicable diseases, non-communicable and mental health and all of that. We all focus, which I admire, is about the triple challenge of communicable diseases, non-communicable diseases and poverty. So let's take a look at this. Africa constitutes less than a fifth of the world population, about 17%. But when you begin to interpose or juxtapose that against what we know epidemiologically around the disease burden, then you see that Africa is disproportionately burdened. Whether you're talking about communicable diseases or non-communicable diseases, or even the whole issue around poverty. The available data shows us that Africa is responsible for about a quarter of the global communicable disease burden in the world. And communicable diseases constitute the larger proportion of African disease profile, constituting about 60%, whereas we see the non-communicable diseases rising consistently over the last couple of years, and it's projected to rise even more as we approach the future. And right now, about slightly more than a third of deaths in Africa are now due to non-communicable diseases. And about 90 million people in Africa are living in poverty. So let's take a look at the communicable disease itself. As we know today, Africa constitutes the larger part of global health deaths in HIV, with Nigeria leading almost virtually one of the leading countries, with South Africa and a number of them, around the issue of HIV burden. About 94% of malaria deaths happen in our continent for obvious reasons. Malaria is endemic in our region, whereas it's largely been controlled or non-existent in many other regions of the world. We have about a quarter of global TB cases, and about 1 billion people, over 1 billion people in Africa, are affected by the neglected tropical diseases, the schistosomiasis, filariasis, and all of that are broadly diseases of poverty. And we know that there is the constant threat of emerging and re-emerging infections, Ebola, Lassa, Mpox, and all of that. So we are a continent that is burdened very greatly with the challenges of communicable disease. At the same time, non-communicable disease has become a rising challenge in Africa, with about 38% of those deaths actually among non-communicable diseases being due to cardiovascular diseases. We are seeing increasing rate of cancer, prostatic cancer among men, breast and cervical cancer among women, and all of that is increasing. We also know that diabetes is increasing both among the rich and among the poor in the African continent. But the greater challenge, as studies upon studies have shown, for example, the demographic health survey, is that most cases are undiagnosed. Most people are not even aware they have the condition, so they cannot access care for themselves. We also know that mental health is rising, particularly among young people. We know that mental health begins for most of about 2/3 of mental health they begin in adolescent age of AI, even though they are not discovered until adulthood. But the challenge is that there's a whole lot of gaps, and most people are not identified as having mental problems. And because of the stigma that surround mental health issues, and the deaths of health professionals in the mental health space, with many people now, most of our workers now jackpot into other parts of the world, the treatment gap around mental health is frighteningly increasing. Poverty in Africa, you may say to yourself, is poverty a disease? The answer is yes. We may not classify it by the standard classification of disease, but there is no doubt that poverty is the mother of all diseases, particularly in Africa. We have more than 55% of the globally extremely poor people are living. Africa is home to about 57% of the world's poorest countries. About a third of people in Africa are lacking water. Almost 2/3 of Africa lack adequate sanitation. So you see a condition where poverty is conditioning people to poor environmental conditions and affecting health in all other dimensions of life. And when you think about this triple challenge, they are not challenges to be seen in isolation. They are not just discrete challenges. They are interconnected challenges, and their combination form what you could regard as a lethal synergy, because one potentiates the other in very significant way. And there are several examples of that. You know that HIV now, because of the drugs that people are using for HIV, is increasing issues of metabolic disorders and cardiovascular conditions. We know that hepatitis B is endemic in our region, and is a precursor to liver cancer. So, TB worsens the challenges of chronic lung disease. And because of poverty, on one hand, people cannot access care, but diseases also push a lot of people to poverty in Africa, about 100 million people. We know that young people or children who grow in households where there is poverty will likely suffer malnutrition, and that will weaken their immunity. And so they are likely to also be easily affected by many other infectious diseases. And so the circle goes on and goes on. So it is a whole lot of potentiating that happens between those three groups of conditions: communicable diseases, non-communicable, and poverty. Indeed, poverty and health has a long and historical antecedent. Studies upon studies have shown that poverty leads to poor health outcome, and poor health leads to poverty. When you take a look at poverty and you consider its effect on health, one of the basic fundamental things when we think about public health prevention, and we talk about things like primordial prevention, taking action to even ensure that conditions that are adverse do not come up at all. You find that poverty tilts that balance significantly because it impacts the material dimension of living, from quality of housing to quality of environment to quality of neighborhood to quality of community to poverty and all of that. To the whole issue around the impact of poverty on mental health and psychosocial issues, chronic stress, social exclusion, and that increases the likelihood of mental health conditions among people who are poor. There's also the behavioral impact, because poverty limits choices. People are more likely to adopt unhealthy behavior. They have less opportunity to live in an environment where they can take walks because they live in a crowded environment. Access to, can you hear me? I'm hearing a lot of echo. I hope it's okay at that end. They can't access services and on and on and on like that. So the poor is naturally, from all we know, likely to have a poorer health and likely die earlier than those people who have better conditions. Let's take a look quickly at Nigeria. One of the things that we see in Nigeria, of course, Nigeria, the most populous country in sub-Saharan Africa, reflects a lot of what we see in Africa and influence the statistics that we see. Every time we look at statistics in sub-Saharan Africa, we more or less almost mirroring the statistics of Nigeria because of our population. One of the things that we know is that poverty is increasing. And I don't need to say that to anybody on this forum. We all feel the impact. We all know what is happening. This chart, which actually is a combination of survey and projection. For example, you might see 2026 and 2027, those are projections. This line, the straight lines actually talk about projections. The red dots, the red circles are studies. And one of the things that this tells us, the combination of the study, which also form the basis for projection, and also looking at the macroeconomic indices, is that poverty is increasing at a significant rate in Nigeria. And the number of people who are poor is also increasingly is also increasing number, becoming extremely uncomfortable for anybody in governance. One of the things World Bank reported in its report that came out in October last year, titled From Policy to People, Bridging the Reform Gains Home, is that the share of the ultra poor, this is Nigerians, who cannot sustain healthy caloric requirements, even they spend all their money on food. People, even when they spend all their money on food, will still not meet their caloric requirements. That proportion increased from 14 to 27% between the 4 year space of 2019 and 2023. And that's about 139 million Nigerians who therefore cannot afford healthy meals because of the poor income. We do know that in many ways, poverty is not just a consequence of people challenge we are talking about. It is a driver. Inability to afford medicine, for example, will drive perpetration of poor health, malnutrition, as I said, weak immunity, poor housing, and all of that. And so we know that poverty is a vicious circle, and it's at the core of the challenges we're talking about, affecting both communicable diseases and non-communicable diseases as a proximate determinant of both of them. And we just look back again at the Nigerian example to illustrate this point. When you take a look at the Nigerian data scenes and look at what's happening in our sexual and reproductive health, one of the very clear things that is evident is the fact that if you look at teenage pregnancy, look at any proximate indicator around health, you find that the worst conditions happen among the poorer people. Here you see that when it comes to teenage pregnancy, among those who are the highest level of socioeconomic indices, only about 4% of them now record teenage pregnancy. But if you look at those who are at the lowest, you find that it's more than 7 times that, about 29%. And that same factor is reflected when you look at the educational level, where those who have higher education have only about 4% of teenage pregnancy, but about over 30% among those who come from poor households. This is about the perinatal mortality. Looking at CBAT in Nigeria, this comes from the Nigeria Demographic Health Survey. When you take a look at the red circles versus the bluish circle, you see a contrast between what happened. Sorry, the bluish circle is the total for the country. The immediate line before then is what you have for the highest. So if, for example, whereas you find 18% for west quintile for the lowest, you see that they are the one that really influence the national data, because those who are highest come to about 14%. So consistently, you find a high level of deaths among children of the poor compared to children of the rich. Again, this is another one. When you look at where mothers who are pregnant will access care or who will deliver them, for those who are the poorest, about 16% of them will be delivered by doctors or nurses. But look at the highest, almost everyone who is at the highest level of socioeconomic indices will get delivered by a doctor or a nurse in skilled care. So when you take a look at Nigerian maternal mortality ratio, and you see the figure that says Nigeria has the highest maternal mortality ratio in the world, it's simply because we have a large proportion of people who are poor, and because they are poor, they are not able to access care, they cannot deliver in their facilities, they are not accessing network care, and all of that. And so we see that what happens to the poor really impact the overall picture that we see of the country when you have a high proportion of people in poverty. So Essentially, those are the connections. But I think it's also important to ask a question about the future of African health. And there are two factors that I think are very important as we think about that. Number one factor is the continuous depletion of the African human resources due to migration. I know that many of you who are listening to me are young people. I guess that some of you, all you are waiting for is to get your MBBS or MBCHB or get your nursing degree, and off you go. So that in itself is one of the conditions that worsens Africa's health scenario and will continue to impact us negatively until we are able to reverse that. One other challenge is the issue about the funding for health. Right now, we know that there's a whole issue around global AIDS. USAID was the leader in funding family planning for Nigeria. And just 2 or 3 weeks ago, about 3 weeks ago now, I just finished leading the development of Nigeria's new HIV strategic plan. I have been privileged to lead the process of developing the strategic plan for the country over the last 10 years. And as we were working on that, one of the core questions we are asking ourselves is where will the money for drugs come from for those who are living for HIVs? Because more than 85% of the money that fund the drugs, the free drugs, they come from USAID, they come from US government. A combination of USAID and CDC and all of that. Same is true about family planning. As of last year, I was doing work for, my team was doing work for a consortium on family planning. And one of the questions that faced us was that more than half of the money for family planning that we needed were not available yet, because that money ordinarily will have come from USAID. And if you think about even the UN family, UNICEF, UNFPA, and all of WHO and all of that, a lot of the fund they use come from USAID. So with that challenge, we must ask ourselves the question, what is the picture for Africa's health? As we think around the funding issue, I love this article that I got from Charterhouse. He said, Africa after USAID, who will pay the health bill? Because somebody else has been paying our health bill. And one of the questions they posed in that article is this: will African government allow the cycle of dependency to continue, or will they reassert their sovereignty over their health system? In other words, will they own their own domestic health system by putting funding that will ensure that their own people can get good health services? That's a question that is yet to be answered, even in Nigeria as I speak. And as we think about that, we often talk about USAID, US, and all of that. But the truth is that the entirety of the global health aid is changing. There is less fund coming to developing countries from almost all the donor countries. Either you're talking about the European Union or you're talking about the Nordic groups and all of that. As the UN Trade and Development said in its report last year, in 2023, aid to developing countries declined for the 3rd consecutive year. So this trend has been continuing and affects sectors that are crucial for sustainable development. It affects health sector, it affects educational sector, it affects youth development sector, and many other sectors where we have been relying largely on donor support. For the OECD, for example, they noted that they projected a 9 to 17% drop in ODA, which come on top of the drop that they had also experienced in 2024. And they remark, as I quote, the outlook beyond 2025 remains highly uncertain. And even as we speak, it still remains quite uncertain how Africa will negotiate this challenge around funding for their sector. So what is it that sustains this triple burden? The underlying factor to my mind, and the biggest elephant in the room, is poor governance and poor accountability. Because Africa is not necessarily poor, but Africa has become poor by lack of governance, lack of accountability of the rulers to the ruled, and the voicelessness of those who constitute the citizens. The citizens seem to allow all kinds of things, and therefore those who are in really position just trample upon the rights and the needs of the people. So that is an underlying factor. The governance structure, the governance performance is a big question in about how Africa will rise up or if Africa will go down even the more. But based upon that governance, we begin to see the effect in different critical sectors. For example, the health system. The health system in Africa is very fragile, very poor quality of services, and inadequate number of health workers, poor health literacy, and all of that. We see education deficit. According to UNESCO, Nigeria has the largest number of out-of-school youths. Young people who are supposed to be out of school, are supposed to be in school, but are out of school. And so they become easy recruits for all kinds of violence, and they perpetrate intergenerational poverty. You find conflict and instability in the whole of the Northeast. And now you have a whole lot of challenge about human displacement. More than 4 million people, according to the latest data from the UN, are in need of aid in Northeast Nigeria alone. And the issue of conflict and instability is growing in the country. Farmers can't go to farm now. So what begin to see is food security begin to get challenging. And the poor will be the most affected naturally. We have in Africa a young generation, a young population, and our level of fertility is still unduly high. And that is raising a question, a challenge about the ability of government to respond to the needs. And because the villages and the rural areas are poor in infrastructure, more people are going to the urban areas. And so we are seeing urban congestion, we are seeing overcrowding, we are seeing shanty towns around urban areas, and we are seeing increased level of violence, increased level of suicide, increased level of mental health conditions begin to come together because of rapid urbanization. Now, of course, there's a whole issue about unemployment or poor level of unemployment. Gender issue is a big challenge in Africa because, as I often say, a bird can only fly best with 2 wings. It doesn't fly with 1 wing. But the gender equality issue in Nigeria seems to paint a picture of a country that's trying to fly with 1 wing. Because particularly in northern Nigeria, there are a whole lot of issues about gender, around education, around access to employment, as autonomy of the women, and all of that. And increasing now, there's also the issue of the ecosystem, the climate vulnerability. Now we're seeing flooding, and because of that, farms have been destroyed, homes have been destroyed, people have been displaced. We are seeing increasing level of arable land being lost, and all of that is they are also contributing to what we are seeing in terms of admin and their clashes with farmers and all of that. So all of these are issues that are sustaining this triple burden. In fact, the climate vulnerability is also changing the ecosystem in terms of the breeding and the activities of the parasites and the transmitting agencies and all that go with that. Okay, so what can we do? A lot of things. Number one, the first place to start, it's about a whole society approach to the issue of social determinants of health. Social determinants of health refers to non-medical conditions in which people are born, grow, live, work, and age. And that is, poverty is at the heart of that. There is the issue of education, access and quality, there is the issue of healthcare and quality, there is the issue of the neighborhood and the environment, there is the issue of social community context and economic stability. We do know from science that between 30 and 55% of health outcomes, poor health outcomes, come from this condition, not the medical, or from the non-medical conditions that all of the life of people, about where they live, where they work, and all of that. So when we begin to address these conditions, they become foundation for turning around these challenges about the triple issues. Number two is the health system. One of the problems in Africa is that we have a health system that is fragile, but it's also increasingly fragmented, because we are dependent on donors. So you see the entire donor community, for example, supporting HIV, and they keep on pumping money to HIV. And in the process, they distort the health system because they create parallel system. The same is true of malaria, is true of tuberculosis. But what Africa needs is not a fragmented system where donors are driving their own agenda. But we need to look at the totality of the health system and the building blocks that we know from what WHO have told us. The whole issue around governance of the health system, information, financing, service delivery, human resources, which I pointed out here is the linchpin, because without human resources, every other thing will fall apart. Of course, the whole issue of medicine and technology, and at the end of that is people. So we need to look at a well-functioning health system to ensure that we can meet the needs of people wherever they live in our country and at whatever level of socio-economic development they might be. The other issue we must address is the issue of workforce migration. Like I said, human resources is the linchpin. If Africa is wasting its money, if Africa is trading people with its money and they keep on migrating, then Africa is wasting its scarce resources and getting nothing in return. And so there's a need for a stronger policy around the whole issue of controlling migration. At the same time, also make it a condition at home that will make it conducive for health workers to want to stay at home, to want to work at home, and to want to impact the life of their own people, because they can function in a system that provides what they need, that supports their work, and enable them to function optimally. Number 4 is the fact that health system runs only on the platform of the people. Don't run health system in facilities; they run in communities. And where there's no accountability at the community system, the health system itself cannot be robust enough. So we need to look for a system. And I'm glad we are working and we're looking at that increasingly with what is happening in Nigerian health sector reform. But how do you ensure we have a people-oriented, community-oriented, accountability-based health system? Not just health system, accountability-based governance system. There are people who can hold their representatives, their elected representatives, to account on basis of the mandate that they have given them. We know there's so much money now in local governments, but who is asking them questions? So you see a lot of stealing is going on, particularly at local government, and nobody is paying attention. Nobody knows, because there's no community-rooted accountability system. There's also the fact that health system cannot do it. What we need is a multi-level intersectoral strategic action, what people call health in all policies. Across all sectors, we need to look at the health issues. We need to look at things like universal health coverage within the health sector and strengthening the primary care center, primary care services. We need to look at how we integrate care so that it can be more effective and more efficient. We need to look at how we prioritize disease prevention, how that pushes too much money into tertiary care that people for a little, just few number of people. Tertiary care level is important for raising human resources, but in terms of coverage of services for the people, is really not yielding the kind of result you expect based on the kind of amount of money is going. So we need to look at how do we recondition the system so that disease prevention and that treatment, care and rehabilitation remains our priority. We need to look at social protection. Social protection are mechanisms where things we put in place to lift the poor out of their poverty. Things like social insurance, things like cash transfer, things like school feeding programs. They are all issues that can help lift poor people from poverty. They are social nets. And Nigeria has a fantastic policy on social protection, but as usual, we have implemented very poorly. I've talked about governance before. I know governance and financing between the health sector and between the larger health sector, and the whole issue about research and innovation, because the currency of the current generation and the future is not oil, it's not natural resources, it is knowledge, it is science, it's invention, it's innovation, it's technology. And so we need to begin to, again, look around the whole issue about research and innovation as a mechanism to lift Africa from its poverty. And we must go on to continue to intensify research. Today, most of the development-oriented research that we do in this country, they are funded by outsiders, and sometimes the results are used by them to our own detriment. And so we must begin to prioritize the funding of research we must begin to look at the whole issue around innovation and digital transformation, using technology to reach people who are not easily reachable because they are far from urban centers or because they are in conflict areas and all of that. So let me move on. The last issue is about investing in young people. Demographic dividend is a possibility for Africa because we have a large number of young people. And if you invest in their education, if you invest in employment for them, and if you invest in their, we are likely to reap what is called the demographic dividend. That's a transformation of our economic situation and economic indices. But if you fail to invest in our young people, we are most likely going to reap demographic disaster because they are going to become a generation that is disenfranchised, dissatisfied, and will likely take to violence and all of that. So let's talk, as I begin to close in the next 5 minutes thereabouts, about students as champions against the people body. And I call this Gen X. I see the current generation of students and of young people around me as people who are problem solvers. In the last 2 days, 3 days, two young people had come to me to show me what they're doing in terms of developing new apps. Medical one just graduated. She's doing to facilitate records retention around children immunization and all of that. So I see a lot of young people with potentials, and I think we are beginning to see what I will call the generation solution. All right. I see a lot of them around my life. 26 years ago, a group started in Obafemi Awolowo University called Campus Health and Rights Initiative. Every year they have a program called Campus Health Forum. This is some of the things they are talking about. In 2023, they are talking about toxic clubs, talking about gender-based violence, dating violence, and all of that. In 2025, they are talking about pleasure, privacy, and power, looking at the balance of power, gender equality, and all of that, and all of that kind of campaign. And those campaigns, when we ensure that they're not limited to our campuses, but taken to the communities, they will have tremendous impact upon the life of people. I was just talking to them a few days ago, the same campus guys, Campus Health and Rights Initiative, which I actually founded 26 years ago for young people to learn to lead and to lead to impact. This year they're talking about talk and do. I mean, how do you go beyond talk to make things happen? A young lady in my university here in Ife, a few days ago, her name is Sumi Shopade, approached me about one new initiative she's having. She's running a campaign to get young girls vaccinated on campus because they find that even though undergraduates are supposed to know a lot about health, that really they don't know and they're not really bothered. And so she started a campaign asking people to support vaccination with 500 naira and all of that. For me, those are very exciting things that I see young people doing. And I'm glad, like I said, that your young people here driving research and all of that. Okay, what can you do? There's several things you can do. One, education and literacy. One of the greatest challenges of our people is that they don't know. They don't know about air conditions. Their knowledge is poor. Their actions is also wrong because they are based on poor knowledge. So one of the best things we can do is to improve their knowledge, to improve their air literacy, to improve their understanding about air conditioning and what they are. Number two, just like you are doing, promote research, promote the use of evidence. Many times we waste money in this sector because we are doing things that have not been proven to work. But using evidence to drive services and to drive intervention will improve results. We must be a voice for the voiceless, advocacy around policy and the rest of it. Innovation and technology, you are the generation that never knew a world without digital equipments. You are a generation that rose up at the time of when phone had become an everyday thing and internet is an everyday thing. So you must continue to use those innovations and technology to change the world. The whole issue of climate health is one issue we must look at and we must continue to talk about because it's likely to tip everything that we do. Just like digital transformation and AI are also changing things in different sectors. We must look at how we support other young people, mental health issue and the rest of that. I wish I have time, but I need to round up in the next few minutes. Yeah, but I think that's where it starts. is this. As I was preparing this, I remember this passage from the Holy Book about a prophet who was condemning everybody, who has a word for everybody about what they are doing right and what they are not doing right, until he himself see a picture, see a reason to look at his own life, and have to say when the voice came that who should I send? I say, here am I, send me. But you know what? For you to say, here am I, send me, for you to say I'll be an instrument to change this in Africa or to change this in my environment, it's not going to come automatically. There are at least 3 elements that you must look at. Number one, your personal development. You must continue to study, you must continue to invest in your own life. You must continue to get mentored and all of that. One challenge I see many times in our environment is that students are increasingly reading less. And when they are even reading, they are so narrow-minded, reading only their profession. You are not going to change the world that way. You need to know about economics, you need to know about politics, you need to know about developmental issues beyond your narrow confine of being a medical student or a nursing student, all of that. You need to your knowledge about what makes for development. Number two, you must have a passion. You must develop a passion. There must be something that pushes you to say, look, it's not about being a doctor, it's not about being a nurse, it's not about the money at hand, it's not about being a scientist. It's about making impact. You must develop consciousness for impact as a philosophy for life. And number three, you must look for how to work with other people, to partner with them, to collaborate with them. That's how you can begin to say, look, I am available, I am positioned to make the difference that needs to be made. Let me conclude now. One of the things about Africa is not about lack of understanding or even knowledge about what we need to do. There's something called Africa's Agenda 2063 that was launched in 2013. I wonder how many of you have ever heard of it. It's a 50-year blueprint for what Africa wants to be and how Africa wants to develop over a 50-year period. And there's a very interesting statement that I read of it 2 nights ago. It says, they are confident that Africa has the capability to realize our full potential in development, culture and peace, and to establish flourishing, inclusive and prosperous societies. End of quote. So if they are this confident, then why have you not seen it? And the reason is this. We talk a lot of talk, but we don't do a lot of doing it. And that is what you must bear in mind if you truly want to transform situations. I was reminded as I was preparing this about an old song I learned when I was a young man. It comes from the hymn. It is titled, "By whom shall Jacob now arise?" I have paraphrased it for Africa. It says, "By whom shall Africa now arise? For African strength are few, and what should fill us with surprise? They seem divided too." That's very pure of Africa. The truth is, internationally and in global community, many other countries are not really our friends. They would rather want Africa to remain underdeveloped so that they can oppress us, they can continue to use us for their own ends. Say, by whom shall Africa now arise? For Africa folks are strong. I read that triumph in their eyes. They think he will fail ere long. By whom shall Jacob now arise? Oh, I didn't change that from Jacob. That's the original one. Jacob now arise. Can end tell by whom? So this song, the last verse, talk about God helping. But I don't think it's about God helping. And I have the greatest respect for God. I have a passion for God. I'm a Christian, and I truly believe in what God does in people's life. But what I'm saying is this: God had already empowered Africa. He has given us resources. He has given us brain. He has given us people. God Himself is even waiting for us to arise. It is not that we are waiting for God to arise. So, by whom shall Africa now arise? I think your generation has the answer. You are the people who can make Africa arise. You are the people who can transform the situation. You are the people who can usher Africa into its new future. I think things about that. Your study, not just your study in school, but study to grow, to develop, to impact. Your willingness to serve and your willingness to sustain your initiative, your intention, your passion, even in the face of challenges. Africa Health future will not be delivered by government alone. It will be built one community, one student, and by one act of service. The generation solution is here. Africa does not need to wait for resources to save African life. It needs to deploy the resources it has, including intelligence, energy, compassion, and agency of you students, young people, with greater wisdom, purpose, and solidarity. The triple challenge is immense. but it's not insurmountable. The tool exists, the evidence exists, but the will must be built. The generation of supervisors is already here. And I want to thank you very much for your kind attention. Thank you.
Thank you so much, sir, for that amazing session and for that poem. And for that poem at the end.